Sagging skin can be such a drag. Joining us for the procedure that surgically tightens the skin while you're awake is board-certified plastic surgeon, my friend, my colleague, my roommate in the office, Joubin Gabbay. Dr. Gabbay, what's going on?
How are you? We're here in the operating room with Taylor, and she is awake and ready to say hi to everyone.
Hi, Taylor. All right, so Dr. Gabbay, let's get started. So tell us, what is the procedure you're going to do? Show us today, and tell us exactly what it's doing and how it works.
Sure. We are going to use this device. It's Renuvion. It's a skin tightening device that uses radiofrequency energy that is transferred to your skin using a nice helium beam, goes underneath the skin after a liposuction procedure, and tightens everything up.
So you did liposuction, you removed the fat, but now you go a step further, and that's where the problem lied with liposuction in the past, that in some cases the skin would even get more loose. So tell us what's happening with the skin.
Exactly. So if you think about it this way, very often in patients who need liposuction, that extra fat is actually pushing out the skin. The fullness pushes everything out. And when you remove the fat, well, then the skin drops. So many of our patients are left with sagging skin. It's often very noticeable in the arms, very noticeable in the abdomen. So traditionally, the solution was some sort of a skin reduction procedure like an arm lift or a tummy tuck, which is a really big procedure, often with a very big scar. Instead, we now are using this minimally invasive device that goes underneath the skin and tightens it all up.
Doc, so you're going to do this on Taylor's arms, and I know we have a lot of viewers saying, well, what makes Taylor a specific candidate, or what makes anyone a good candidate for this particular procedure?
Absolutely. Taylor is a great candidate for a lot of reasons. Taylor is actually the young mom of a 9-month-old girl, and she's always been fit. She's always taken care of herself, both before and certainly after the pregnancy. But she just noticed that after the pregnancy, first of all, there was a little bit more fullness in her arm than she wanted, and she couldn't get rid of it. And worse was that loose skin was there. She would jiggle her arms, and they really, really had a lot of looseness to it. So, that's a great setup for this procedure. Also, what's great is that she's young, she's healthy, she's got good, thick skin, all of which will give a really beautiful...
She's the perfect candidate, Dr. G. Let's get started.
Let's do it. All right, so we're going to take this device, and very easily we just put it under her skin and just go at it, back and forth.
And you've already liposuctioned, right, Dr. Gabbay?
Exactly. Liposuctioning creates a nice empty space underneath the skin, which will allow the J plasma to run through, the Renuvion.
So the next question that I think everyone's going to have is, how long is the recovery, and when's she going to start seeing results?
The beauty of this procedure, especially when I do these procedures with patients awake without general anesthesia, is that the recovery is really quick. They're sore for 3 to 5 days, and then they get back to their lives. The results are actually immediate. You see it, but they get better and better as time goes on, and the skin continues to shrink. They are essentially semi-permanent results, which will just go along the natural aging process. So they set your arms back in time, tighten it up, and let you age.
And Doc,
normally.
especially if you combine it with diet and exercise, it's a winner-winner, right?
Absolutely.
Now,
sure
I
is.
know the cost because I do it too. I work with you in the office. I'll see you next week. But for everybody out there, about how much are we talking about fee-wise?
So it adds a few $1,000s to a traditional liposuction procedure. So it's fortunately not a really devastating cost or anything like that. Just an add-on to what you would normally do with lipo.
It's a winner. Thanks for sharing, Dr. Gabbay and Taylor. You're in good hands. Best of luck.